Hi, this is Dr.Geetha Nagasri Neerukonda, Senior Surgical Oncologist from Care Hospitals, High Tech City. Yeah, today I am going to talk about diabetes and cancers. Diabetes and cancers are the two major diseases which has tremendous impact on health worldwide. What is the relationship between diabetes and cancers? Is risk of cancer increases with the diabetes? Yes, to some extent. Some cancers like pancreatic cancer, endometrial cancers, breast cancers has twofold increase in diabetes patients, and some cancers like colon cancer, bladder cancers has definitely like 1.2 to 1.5 fold increase in diabetes patients. What is the relationship between both are communicable diseases which has major impact on health of the people. The common etiology being, both are lifestyle diseases. The common etiology being obesity. Mainly type 2 diabetes. The obesity is a major cause for type 2 diabetes, and it is also major cause for some cancers. Like cancer is also, some cancers are lifestyle diseases like endometrial cancer in women. Because of the obesity, even in even premenopausal and postmenopausal women, because of the obesity, excess production of estrogen will be there. That estrogen will act on this uterus, and that endometrial layer will get hyperplastic, and this hyperplastic endometrial layer will turn out into the cancer after some time. So definitely obesity has it, and breast cancer has also obesity has lot of influence on breast cancer also. And not only this, in the treatment part, once cancer is diagnosed, to do surgery also, if severely diabetic, we have to control the sugar levels. Even in the post-op period, even non-diabetic recovery will be very fast compared to the diabetes, because of the like delay on the wound healing. And once wound healing is delayed, when this process is delayed, again the other cancer is not the one time the surgery over, not like that. Cancer is the ongoing process. After surgery we have to do patient has to undergo chemotherapy, then after radiation, all this process will also be delayed. And also in the diagnosis of cancer, PET scan mostly in the spread of the cancer, metastatic, as a part of metastatic workup we do PET CT scan. PET CT scan is based on, it is tagged, that radionucleotide is tagged to the glucose only. The uptake, based on the uptake we see where it is spread. This uptake is there in high glucose uptake cells only. This uptake will be there. That was shown as uptake. So it is used in the diagnosis also. So that is the reason with diabetic patients we control the sugar and do PET CT scan, because if it is sugars are high in diabetic patient, we do PET scan, it won't be correct. So always the sugars will be controlled, or if it is high also, in that level they give insulin and do the PET CT scan. And moreover, not only this, and this process of there is something known as beyond this insulin resistance, there is something known as inflammatory pathway which is triggered by this hyperglycemia. That inflammatory pathway is this IL-6 and this STAT. This inflammatory markers will be released, so they suppress the tumor suppressor cells. Then this neoplastic cells and proto-oncogenes, this neoplastic cells will get activated and malignant proliferation will be there. That is a one pathway explained for the relation between the diabetes and cancer. And definitely the both are lifestyle diseases. How should we prevent? Prevention is very better than cure, we always tell. And prevention aspect we should always talk about. How should we prevent? There is certain factors which is non-modifiable, certain practice which is modifiable. What are non-modifiable practice? Our age, our genetics, the genes we acquire from the parents, that is not modifiable. Our race, our ethnicity, all these are non-modifiable. But it's certain risk factors which are modifiable. What is that modifiable risk factors? Our obesity, our weight, we can control our weight, we can reduce our BMI by doing regular exercise, physical activity. All these modifiable risk factors, we have to work on that, because if you are obese, you should reduce the weight, reduce the BMI, so that this diabetic will be under control, and all these it is a prevention for all these diseases. And especially I am telling the women, nowadays more than 40% of teenage girls are having polycystic ovarian disease. This polycystic ovarian disease is a metabolic syndrome where they have all these irregular periods, then anovulatory cycles especially, and this anovulatory cycle is hyperestrogenism. This will cause hyperplasia and endometrial cancers later. Irregular periods, infertility, and hyperinsulinemia, diabetes. So only remedy for that is weight reduction, maintaining the good lifestyle, proper healthy lifestyle. How healthy lifestyle we can only do when we eat regular, we take food regular and healthy food containing lot of fruits and vegetables, do exercise regularly, maintain ideal body weight, and constrain from these habits like alcohol and smoking. So this should be modified. So both diabetes and cancers can be prevented by modifying these risk factors and changing the lifestyle. Thank you.